A very good evening, friends, and a very warm welcome to our next episode of KK Med Talks Non-Stop Show. And today we are here with the Med Talks Live, Conversations That Matter. This is an educational initiative started by Eli Lilly, and I am Dr. Nitin Kapoor, your host for today. Friends, today is a very important session that we have. It's on Obesity Talks. Today we have the 15th episode, and we are going to be talking about investigations, when to check and when. But before we go on to that, let's have our obesity updates video. So, what are the key updates for obesity today? I think the first one that I'd like to say, which is dearest to my heart, is talking about normal weight obesity. And a recent study tells us that 1 out of 4 individuals in our country have normal weight obesity. They have a normal BMI and a normal weight, but they have high body fat. The second update, more recently published, data on environmental exposures and weight risk. And this is especially talking about certain environmental metals. We often indulge in a lot of metals in our day-to-day practice and day-to-day livelihood, but some of them have now been linked to belly fat and even associated with a higher heart disease risk. Another study tells us about earlier testing for better prevention. I think we've known that saying for very long: prevention is better than cure. Experts now advise that people being evaluated for obesity should get their routine blood test today, and we learned today about that, and that helps to prevent a major problem coming later on. Another study on wearable devices has told us that wearable devices are helpful to detect risks much sooner. And we are in a technology world today, and yes, a lot of technology has come up with respect to health related aspects, and these are proving to be useful. Another study on artificial intelligence, and we've had a big summit in Delhi very recently. We learned that smarter technology for personalized care using AI, what is known as the digital twin for personal health, is something which is developing very fast. This is a facility which will help doctors understand a patient's health and respond to treatment in a better way. Now we move on to the topic of the day. So we're talking about investigations, what to check and when. And who's going to answer all these difficult questions? Well, it's a big pleasure for me to welcome my dear friend, Dr. Suneet Kumar Verma, on stage today. He's joining us to answer all the difficult questions that we have. जो भी आपको पूछना है आप पूछ लीजिए. डॉक्टर साहब है हमारे पास, बड़ी मुश्किल से उनका टाइम मिला है, so we can answer all the questions जो वो बताएंगे. But just a very brief introduction about Dr. Suneet. He is a very famous physician, a diabetologist known for his very comprehensive patient-centered care in metabolic and lifestyle diseases. Dr. Suneet is a senior consultant physician and diabetologist at the Alchemist Hospital, where he's involved in really giving good patient care. But he was even more busy at his own practice in Sparsh Clinic, and he's focused on personalized care for management of obesity and diabetes. A warm welcome, Dr. Suneet.
Thank you, sir. Thank you for your kind words, and so happy to see you on board. And it's actually always a pleasure to listen to you, sir.
थैंक यू सो मच डॉक्टर सुनीत. तो अब हम बात करते हैं आज के टॉपिक की, और बहुत सारे क्वेश्चंस हैं डॉक्टर सुनीत के बारे में पूछने के लिए. बट काफी लोग पूछते हैं और बोलते हैं कि जब भी डॉक्टर के पास जाते हैं बहुत सारे टेस्ट लिख दिए जाते हैं, एंड कौन से टेस्ट करवाने हैं, नहीं करवाने, इतने सारे टेस्ट क्यों होते हैं. तो आज हम डॉक्टर सुनीत से सीखेंगे कौन से टेस्ट कराने चाहिए, कब कराने चाहिए, स्पेशली जब ओबेसिटी के बारे में बात करो. मेरा पहला क्वेश्चन डॉक्टर सुनीत आपसे ये है कि क्या रूटीन टेस्ट एक पेशेंट जिसको ओबेसिटी है, जिसको मोटापा है, उनको कौन से टेस्ट कराने चाहिए?
बहुत ही कॉमनली हम लोग अपनी ओबेसिटीज अपने क्लिनिक्स में देखते हैं जो पेशेंट्स आ रहे हैं, तो आजकल काफ़ी अवेयरनेस बढ़ गया है. लोग अपना काफ़ी सारा टेस्ट करवा के भी लाते हैं. अर्लियर I used to say भाई इतना सब टेस्ट करवाने की क्या जरूरत है, but sometimes nowadays there are like time people are doing like bit aware of कि क्या टेस्ट करवा के लाना है, तो मोस्टली लोग एक कॉम्प्रिहेंसिव मेटाबॉलिक प्रोफाइल करवा के ले आते हैं. सो क्या उसमें से सब कुछ करवाना चाहिए था, क्या नहीं करवाना चाहिए था, हमारे ओबेसिटी में हमें क्या टेस्ट कर लेना चाहिए? मोस्टली पेशेंट्स में व्हाट वी नीड इज liver function test, thyroid function test, to some extent kidney function test also helpful, and we need blood glucose level, fasting blood glucose level, 3 months का एवरेज HbA1c लेवल वो काफ़ी अच्छा है. एंड कुछ यदि करवा सकते हैं तो 2 hours आफ्टर फूड जो हमें करना चाहिए, 2 hours PP blood glucose level, that is useful. Then very specific thing, if we are considering some specific reasons, if a patient is going for the first time to a doctor, these basic profile, lipid profile test with cholesterol level test हो गया, आपका किडनी लीवर फंक्शन टेस्ट हो गया, आपका थायराइड प्रोफाइल टेस्ट हो गया, आपका ग्लूकोज लेवल हो गया, दिस इज मोर देन इनफ. But now a doctor you need to see, are we suspecting some reason for secondary reason for obesity? If you are suspecting something, then we have specific test. Then we say cortisol level check करवा के देखो, ACTH level check करवा के देखो. Then we sometimes we need insulin level fasting, insulin check करके देखो खाने के बाद, insulin level check करा के देखो. Different चीजें. So there are a different number of battery of tests which may be needed. Then comes other than blood test. What else we can need? We need something to assess effect of body fat effect on maybe on liver. We want to look into fatty liver status. We need ultrasound, basic ultrasound. More specifically, we can go for a fibroscan, which give a more specific yield regarding effect of fat on body, how it has impacted our liver. So what we see is then a specific test for cardiac. If we suspect something, obesity related problems in the heart. If we suspect some osteoarthritis, early onset osteoarthritis means problem with joints, we can ask for some specific tests. Maybe some x-rays needed if a person is limping because of a knee pain and hardly of 40 years of age. He should not. So obesity may be leading some effect because of its on weight on their joints. So test actually, if a person is going to a doctor for the first time, a comprehensive basic metabolic profile is more than enough. Now, in among specific tests, we may need a lipoprotein A, we may need ApoA, ApoB, if we are suspecting something cardiovascular. So these are the newer, relatively newer kind of tests which we really try to look into if we have a facilities and a person is affording. So these are tests that we usually see.
थैंक यू सो मच. आपने बहुत ही कॉम्प्रिहेंसिवली हमें बताया. बहुत अच्छी एक बात डॉक्टर साहब ने बताई कि कुछ बेसिक टेस्ट हम बहुत सारे पेशेंट्स पे करते हैं और बाकी पेशेंट देख के एक पर्सन सेंटर्ड तरीके से हम कुछ टेस्ट पेशेंट को देख के, पेशेंट को समझ के उस पेशेंट के लिए क्या टेस्ट जरूरी है वो डिसाइड करते हैं. तो 2 टाइप के टेस्ट, बट वेरी गुड. बहुत सारे लोग आपको ग्रीट कर रहे हैं. राम जी अग्रवाल आपको ग्रीटिंग्स भेज रहे हैं. बहुत सारे लोग, हेलो डॉक्टर्स, गुड इवनिंग, नाइस इनिशिएटिव. और बहुत सारे क्वेश्चंस भी आ रहे हैं हमारे ऑडियंस के पास से, तो वी विल टेक देम वन एट अ टाइम. आपने बहुत सारे टेस्ट बताए. हम कुछ टेस्ट के बारे में थोड़ा डीप जानकारी लेना चाहेंगे हमारे आज के व्यूअर्स के लिए. एंड उसमें ब्लड शुगर और कोलेस्ट्रॉल बहुत ही जरूरी टेस्ट है. दोनों साइलेंट बीमारी है, पता भी नहीं लगता है कि किसमें कितना कोलेस्ट्रॉल या शुगर होगा, गेस करना बहुत मुश्किल होता है. तो इसके बारे में इन दोनों टेस्ट से क्या हेल्थ रिस्क पे असर पड़ता है, आप क्या बोलेंगे?
Obesity, high blood pressure, high blood glucose level, high cholesterol level, and now fatty liver. They all are interlinked. They are not different illnesses. We are looking into like common soil hypothesis as we were looking. We were talking about common soil hypothesis. Now looking in a broader term also. Now we know if we go in a database or from the what we are searching, what people are searching about obesity on internet, the most searched molecule as of now is GLP-1 receptor analogs. Why this molecule has come into play? Now science is understanding that obesity, diabetes, high blood pressure, fatty liver, they are somehow linked to each other. Now they are working on a basic root cause of all these things. So all these things are actually linked. If we correct the basic problem, things will start improving. So rightly said, sir, this blood glucose level, this diabetes problem. Diabetes problem is a big issue. Patients usually still the patients, especially in the rural areas, still comes to us. Doctor साहब, I don't have any symptom. मुझे तो पता ही नहीं लगा मेरी शुगर बढ़ गई. Still people are waiting. The diabetes will tell that I am there. So the time diabetes is going to tell us कि I am there, it's already very late. So best thing is be proactive. Please get your glucose level tested at least once a year if you are not diabetic. If you have a family history, maybe get it done more frequently. If you are having a borderline diabetes, we call it pre-diabetes. If somebody is pre-diabetic, maybe get it checked twice in a year. How does it like? It's not going to affect the finances also. And one, we have seen people coming with a HB1C of 6.1 6 months ago, now coming with 8.1. So things can happen. Something may have changed, like maybe some concurrent illness has caused this much of flaring of glucose levels. So please check the blood glucose level. This is very, very important. And do not wait for symptoms to come before you actually start looking for your diabetes. Another biggest problem is hypertension, high blood pressure. High blood pressure problem is again it's like asymptomatic kind of illness. Cholesterol will not cause any symptoms. Doctor, I don't have any problem. I don't have any shortness of breath. My cholesterol level is high. So people are relating shortness of breath or some exertional dyspnea with high cholesterol level. But this is not true. The shortness of breath is a feature of complication of high cholesterol level. It's not a feature of high cholesterol level. It's a complication of high cholesterol. Some problem is there. Some diastolic dysfunction has occurred. Some kidney dysfunction has occurred. And now we are looking at a complication and the symptom to look into that my cholesterol was high. So this is not done. Please get your cholesterol level checked. This should be checked in every patient. And especially now we are seeing so much prevalence of diabetes among our adolescent people. Even if you look into their cholesterol levels, it's very high. So it's not like we need to wait for a particular illness symptom to come. When diabetes is going to be symptom, it's very high. When blood glucose level is more than 400. So why should we wait? So this is how we must check in any obese person. What is obese? Obese is like again a problem. We consider like in most of the patients, still it's unfortunately obesity or slightly more weight is considered as a sign of wealthiness, which is not true. Now things are getting changed in Western world. A fit person, a lean person is considered wealthier. The poor person is usually obese. So things are changing. But in our country, still we consider an obese person as a wealthy person. So खाते पीते घर के हैं सब, इसलिए थोड़ा वेट तो रहेगा. But it's not like that. वो खाते पीते घर का जो प्रॉब्लम है ना सर, वो प्रॉब्लम इज बिग. So this will lead to all type of complication. So we keep on checking our blood glucose level, fasting glucose level, 3 months ka average glucose level, postprandial glucose level, and lipid profile. Lipid profile. I'm not saying total cholesterol only. We need to check HDL. We need to check LDL. We need to check triglyceride level. In India, especially in Southeast Asia, especially India, we have a very peculiar kind of dyslipidemia. It's not same as that of Western countries. We have a high triglyceride level. We have a very low HDL level in our country. We have a just marginally raised LDL level. It's not very high. Unfortunately, that marginally raised LDL level is more atherogenic than in a Western counterpart. It's a small density, a small dense LDL, which is actually more atherogenic as compared to our Western counterparts. So please don't wait before it actually starts affecting our organs, causing us damage, and then we are looking for like management of complications rather than management, proactive management.
थैंक यू सो मच. बहुत ही प्यार से, बहुत ही डिटेल में आपने बताया ग्लूकोज और कोलेस्ट्रॉल कैसे चेक करना है. बहुत सारे क्वेश्चन आ रहे हैं आपके लिए, बट एक इंपॉर्टेंट क्वेश्चन जो सारे पेशेंट्स पूछते हैं, जिनको सब मालूम होना चाहिए. आपने बात करी फास्टिंग ग्लूकोज की, तो द क्वेश्चन हियर इज हाउ लॉन्ग शुड बी वन फास्टिंग, before going for a test for a fasting glucose? Till what time can they have their last meal or a snack in the night?
Sir, 8 hours of fasting is good enough. So this 8 to 10 hours is actually 8 hours of fasting is good enough. So that is 8 to 10 hours of fasting.
आंसर मिल गया। 8 घंटे के लिए डॉक्टर साहब बता रहे हैं कि फास्टिंग इज हेल्पफुल एंड दैट इज इम्पोर्टेंट। अदर क्वेश्चंस आल्सो कमिंग अप एंड बात हो रही है लिवर डिजीज की चैट बॉक्स में। तो आप डॉक्टर सुनीत क्या बोलेंगे? हाउ इज लिवर हेल्थ linked to obesity and how important is that to evaluate, और उसके लिए क्या टेस्ट करना चाहिए?
So when we were students, we have a very small column in Harrison. I don't remember the page number, but it was on left side lowermost column in my edition of Harrison about fatty liver disease. Hardly 1/8 of a page on fatty liver disease. And now we know this is a big, big, big issue. Fatty liver is not, we call it now MASLD. That fatty liver is not innocuous fat in liver. It's a biologically active, hormonically active fat causing all type of inflammatory problems, leading to all type of damage, not only locally in the liver but everywhere. Now, we do understand the most common cause of cirrhosis, most common cause of end-stage liver disease, most common cause ultimately leading to hepatomas or liver carcinomas is now this fatty liver disease. And fatty liver disease is not that innocuous. And the most important reason for fatty liver disease is not on alcohol, it's basically MASLD, non-alcoholic. So it's a metabolism associated problem, which is actually leading to a huge epidemic of this fatty liver disease. And the most of the patients who are coming to us, unfortunate people who are saying, because who are not aware of, and that's why I'm saying unfortunate people, they were not aware of. They had like खाते पीते घर के बंदे हैं, किस दिन चेक करवाते हैं तो पेशेंट सिरोसिस में हो. And it's not uncommon for us to diagnose cirrhosis, maybe couple of patients daily on daily basis. So we see ultrasound, fine granularity is there, coarse granularity you see on the surface of liver. But almost these are very young patients who are coming, unfortunately, with all this problem. So it's a diet, it's a lifestyle, everything is to be blamed. And obesity is a major contributor for development of this uh, deadly kind of complication of liver problem. So definitely it has a strong association with obesity, sir. And this obesity is leading to a huge epidemic of MSLD. I think after diabetes and hypertension, this is a huge problem which is coming up in a very big way. And we are facing a challenge because for kidneys, we have dialysis machine. For liver, we don't have anything. And you start failing, and sometimes very rapidly, then unfortunately we have nothing to offer to our patients on a concrete basis. So, except for a liver transplant, which is actually a big issue. It's a huge issue. It's not like a kidney transplant. A person can get it easily then. So, better late than better be aware than be very late. So, management is simple. Prevention is simple. It's not management. Prevention is actually simple. Please try to fight this obesity. And among our adolescent is actually easy. Unfortunately, fast food, easy access of fast food. And I don't want to say anything on a brand name of those people providing food at night. Everyone knows. You just dial and every food is available in the middle of night. Who needs our food after having dinner? Our kids are having food after having dinner. At 12, at 3 a.m., at 5 a.m., everything within 15 minutes. It's so easily accessible. And what else it will cause? It will cause epidemic of obesity, problems with the liver, with diabetes, everything, with not even a single use of these kind of things in our kids. So this is like definitely rated, sir, rightly said, and huge problem of fatty liver disease with obesity. Sir, you are mute, sir.
राइट, सो बहुत डिटेल में हमने प्यार से समझाया। डेफिनेटली लिवर इज एन इम्पोर्टेंट एस्पेक्ट। जैसे उन्होंने बताया कि 20 साल पहले किताब में एक पैराग्राफ था, अब पूरी किताब उस पर बन गई एंड इट हैज रियली एक्सप्लोडेड बिग टाइम। काफी लोग अभी भी ज्वाइन कर रहे हैं, आपको ग्रीट कर रहे हैं। अली नजाकत जी आपको गुड इवनिंग बोल रहे हैं एंड रवि एम जी भी बहुत सारे क्वेश्चन भेज रहे हैं, हम आएंगे उन क्वेश्चंस पे। पर एक क्वेश्चन जो बार बार चैट बॉक्स में आ रहा है, आपने कुछ रूटीन टेस्ट के बारे में बात की एंड यू सेड दैट यू नो दीज आर द टेस्ट दैट वी शुड डू व्हेन वी गो टू द डॉक्टर फॉर द फर्स्ट टाइम। बट देन अगर वो टेस्ट नॉर्मल है तो कितने दिन में रिपीट करना चाहिए, ये एक क्वेश्चन बार बार आ रहा है। सो व्हाट वुड यू से अबाउट दैट?
Sir, very common mistake I would say is like my liver function is normal. I do take alcohol daily, but डॉक्टर साहब मैं अपना लीवर फंक्शन हर 6 महीने करवा लेता हूँ, दिस ऑलवेज नॉर्मल। मैंने अल्ट्रासाउंड भी करवाया था, उसमें भी फैटी लीवर ग्रेड 1 चल रहा है फॉर लास्ट 5 years, उसमें कोई प्रॉब्लम नहीं है। So these kind of tests and these kind of reports, these kind of people we usually see in our opinion is a routinely basis. And as a non-medical person, he is not wrong. मैं रोज पीता हूँ भाई, कुछ नहीं हुआ है मेरा, देखो लीवर फंक्शन टेस्ट भी नॉर्मल है मेरा, ये सब कुछ भी नॉर्मल है। सो what is the accuracy of this test to detect underlying liver disorder? Actually poor. The correlation is not that good. It's not always that when we find transaminitis and we will say we have a fatty liver disease. It's not always there. And the person who has asked this question and when to repeat this test, if a person is asymptomatic, his lifestyle is active, so once a year is more than enough. If you are getting something on test more frequent, maybe 6 monthly, they should be.
इसी के साथ एक और क्वेश्चन मयूरी जी पूछ रहे हैं कि बच्चों में भी ओबेसिटी और मोटापा भी बहुत ज्यादा है एंड उनके लिए आप क्या बोलेंगे कि उनके लिए कब टेस्ट कराने चाहिए?
टेस्ट से पहले मैं बोलूँगा माँ बाप का काउंसलिंग करना ज़्यादा ज़रूरी है। सो वो बहुत ज़रूरी है, हमें समझना ज़रूरी है कि हमारा जो बच्चा है इसको हम ओवरफीड कर रहे हैं, ओवरफीड कर रहे हैं, दिस इज़ नॉट गुड। हमें लगता है कि इसने कुछ नहीं खाया, तो ये हवा खा के तो वेट नहीं बढ़ाया ना। तो दिस इज़ अ प्रॉब्लम व्हिच वी यूजुअली सी इन ओबेसिटी एंड दे जब से सर थोड़ा-सा वेट कंट्रोल करना चाहिए। बच्चा साथ आया है, ही इज़ नॉट एज़ अ पेशेंट बट एज़ अ अटेंडेंट। एंड लुकिंग एट अ फेस, चाइल्ड इज़ लुकिंग लाइक अ 22-23 साल का बच्चा है, एज कितनी 12 साल। Okay. Premature, everything like precocious puberty is there, and everything is there in that child. And the weight is 80 kgs, it is 90 kgs. So these kind of things like we really need that Akshay with kuch. Even then, the sick immediate without any pause. But we are gonna listen from our that patient is तो खाता तो कुछ नहीं डॉक्टर साहब। Then you start
Right.
asking history from the patient, from the child itself, then he'll tell you क्या नहीं खाता है। So we really need to look into ourselves. बच्चे को जितना ज़रूरत है उतना देना है। एंड रिगार्डिंग टेस्ट, रूटीन टेस्ट जो हमने बताया तो वही करने की ज़रूरत है। अनलेस एंटिल वी आर सस्पेक्टिंग समथिंग सिंड्रोमिक, वो डॉक्टर साहब ही बता पाएंगे देख के। तो जब हम रूटीन में टेस्ट करवाने के लिए जाने की कोशिश कर रहे हैं तो उसके लिए बेसिक टेस्ट वी नीड टू अगेन गेट आवर ब्लड ग्लूकोज लेवल प्रोफाइल, लिपिड प्रोफाइल, and if obesity is very much there, then the grossly obese child is there, then please go for ultrasound also. We don't need X-rays for joints. We don't need this kind of test, but basic kind of profile is needed: liver function profile, thyroid function profile, and we need glucose levels. So these are the things which we really need to look into in kids and adolescents.
वेरी इंपॉर्टेंट। तो ठीक है, हमने काफी समझ लिया क्या टेस्ट करने चाहिए, ग्लूकोज के बारे में देखा, कोलेस्ट्रॉल, लिवर के बारे में देखा कि कब रिपीट करने चाहिए और बच्चों में कब देखना चाहिए, वो इम्पोर्टेंट है। बट अब जो एक क्वेश्चन जो चैट में आ रहा है वो पूछ रहे हैं थायराइड के बारे में, थायराइड एंड वेट गेन। रुचिका वाधवा जी पूछ रहे हैं कि वेट लॉस कम करने से क्या थायराइड ठीक हो जाएगा या बेटर हो जाएगा, तो क्या कहेंगे? तो थायराइड की वजह से कितना वेट होता है, क्या है रिलेशनशिप थायराइड एंड वेट गेन का?
Thank you so much, sir. Thank you so much for asking this question. And this is like I keep on answering this question in OPD. And this is a beautiful question, sir. Thank you so much. Yeah, like patient is coming to us with a TSH of 5.6, 5.2, and BMI is 39, 40. Doctor, it's all because of thyroid. It's all because of thyroid only. मेरा तो ठीक था, मैं thyroid ने किया। So, what is medical fact about this thing? It's not. medical fact is thyroid hypothyroidism can lead to weight gain mainly because of fluid retention, not because of increase in body fat content. So the contribution of thyroid leading to fat accumulation is actually very low. So, so unless until patient is having a gross hypothyroidism, and to some extent that will lead to some extent, only some extent, this will lead to fat deposition. So correcting hypothyroidism will lead to weight loss because of fluid loss, not because of fat loss. What we really need is we really need uh, to look into the diet, which is going to be in 99% of cases, which is going to be at fault. His physical activity or her physical activity is going to be at fault. Or maybe some other disorder, maybe some medications, maybe some antipsychotic drugs, maybe some antidepressive drugs is going on, which we do not acknowledge, maybe some anti-migraine drug, which may be responsible for a weight gain in that. So please look into different causes rather than blaming thyroid as an enemy, and that as like blaming everything on thyroid. Then you start treating thyroid. सब वेट तो वहीं खड़ा है, अब प्रॉब्लम ही वो नहीं थी, तो वेट तो वहीं खड़ा होना है ना.
Very common question in the OPD. बहुत ही प्यार से समझाया. A clear message to all our listeners today. जो थायराइड की वजह से वेट गेन है वो बहुत ज्यादा नहीं होता है. हमने TSH 200, 300, 500 भी देखे हैं. ठीक है, उसमें 5 या 10, 5 या 7 किलो में बोलूंगा वेट होता है. पर जो BMI 39 जैसे उन्होंने बताया, जिसका आइडियली वजन 60 किलो होना चाहिए और 100 किलो है, वो 40 किलो आप थायराइड को नहीं ब्लेम कर सकते. और स्पेशली सो अगर आपका TSH 10 से कम है तो बिल्कुल भी थायराइड के पे ध्यान नहीं देना है, आपको ध्यान देना है अपने लाइफस्टाइल पे. सो वेरी इंपॉर्टेंट क्वेश्चंस. एंड बहुत सारे इस पे और भी क्वेश्चन आ रहे हैं. एंड यू नो इट इज बीइंग आस्क्ड कि थायराइड जब आप वेट कम करते हैं तो कितना थायराइड इंप्रूव हो सकता है. तो आई थिंक डेफिनेटली वेट और थायराइड का एक बहुत रिलेशन है. रादर अब मोर रिसेंट गाइडलाइंस में वेट के बेसिस पे जो TSH कट ऑफ होना चाहिए वो भी आ रहा है. तो डेफिनेटली वेट कम करने से थोड़ा TSH कम हो सकता है. कॉम्प्लेक्स हार्मोनल तरीके से होता है बट हो सकता है. सो दैट इज वेरी वेल आंसर्ड. वेरी इंपॉर्टेंट क्वेश्चन. नेक्स्ट बात करें अगर हम ब्लड प्रेशर की, तो शुरू में जब आपने बताया ओबेसिटी के साथ डायबिटीज है या ब्लड प्रेशर है, वो भी कॉमनली एसोसिएटेड प्रॉब्लम्स है. तो what is the role of blood pressure in a patient with obesity with respect to his or her overall health?
Sir, blood pressure is another silent killer, as we were discussing in the beginning of this talk. Blood pressure is like universally among our patients, as like blood pressure will definitely cause some symptoms. This is a notion in general public. This will either lead to headache, or maybe some dizziness, or maybe some shortness of breath. Otherwise, there is no BP. Look, so my BP is normal. This is like 160, 170 for last 10 years. और मुझे कोई सिम्टम नहीं है, मैं उसकी दवाई नहीं खाता हूँ. And this is pretty common in my setting where most of the people are educated, literate, and well affording. But all these have the same statement. This is not causing any defect, any problem. So I'm not taking treatment. This is normal. मेरा BP इतना normal इतना रहता है. तो normal भी है, वो इतना रहता है. So it's not like that. Blood pressure, high blood pressure is high blood pressure. Now guidelines say blood pressure should be less than 128. We're not even saying 121. It's not like to sell medications, somebody has reduced the values. No. Who decide which is high, what is low? It depends on, in majority of people, what value causes complications. What are the complications of high blood pressures? The most common, there are enough number of complications. To name the organ and everything is affected by blood pressure, high blood pressure. So most common complication which we with people do understand is cardiovascular complications, heart problem, brain का problem, स्ट्रोक हो गया, अंदर ब्रेन का हेमरेज हो गया, या हमारा हार्ट के अंदर कोई ब्लड वेसल रुक गया. So these are the most common things which we understand. What else is very important? Like kidney problem, eyes problem, very common and very debilitating kind of complication blood pressure. So blood pressure is again a very silent killer, and please keep it checked, and has a very strong association with high BMI or obesity. So obesity leads to high BP, and this BP, definitely blood pressure, high blood pressure, definitely have a enough number of complications. High blood pressure, diabetes, obesity, these are interlinked problems. So we really need to target blood pressure to the normal values, not to the normal for that person. In this case, elders are different. They may not tolerate a blood pressure of 120/80 in many cases. It's okay for them. We'll keep 149. It's okay. Okay for them. For elders more than 85 years of age, I'm talking about. For a general person, for people who are actually younger than me and coming to us saying my normal blood pressure is 160. It's not normal. It's a lack of knowledge or maybe ignorance. So please be very vigilant for a normal, what is normal blood pressure. So blood pressure must be less than uh, 130/85 in majority of patients, but in a young patient, it should be less than 120/80, which is normal. When do we start treatment? So things are like obesity, two things: high salt intake, high salt intake for blood pressure in obesity is strongly associated with high blood pressure like, and fluid retention, both. Salt intake in our country is very high, and which is also needed because we have like very hot environment and we sweat a lot. So that is needed. So we don't say complete abstinence from the salt, but reduce salt intake, whereas salt intake is actually very high. Another thing which is linked is like our intake of calories, which will again increase obesity, and obesity is going to again increase blood pressure. So blood pressure is to be controlled. The two things are absolutely cross-linked, interlinked. So we have to work hard on controlling blood pressure, be it lifestyle modification. Lifestyle modification comes first in all type of lifestyle disorders, be it diabetes, be it hypertension, be it obesity, be it the fatty liver disease, everywhere. Lifestyle modification is the only is comes first, but that should not be like only lifestyle modification. Lifestyle modification, and regarding lifestyle modification, sir, I just want to say one more thing. Lifestyle modification is this should be for life, not for a day, not for a month, not for 2 months. I have desired blood pressure now, I have a desired blood glucose level now, I have a desired weight now, and I'll eat anything. This will again go back. So word is lifestyle modification, it's not a monthly modification. So I had to be modified.
Absolutely. बहुत सारे questions आ रहे हैं. I think maybe we'll take one or two questions from the audience before we go ahead. And अल्पा पटेल जी पूछ रहे हैं कि उनका वजन लास्ट 1 महीने में 2 किलो बढ़ गया, and she is running into her 52 years of age and is perimenopausal. She has disturbed sleep. And वो पूछे कि ये 2 किलो इस एज के लिए नॉर्मल है? Could it be because of the menopause? Could it be because of poor sleep? Thyroid? वो क्या टेस्ट कराएं?
Comprehensive metabolic profile is definitely, as we discussed, should be done if it is not done already, and please look into some reasons. And the most important factor she is told is she is 52 years of age, and 52 years of female is having is the perimenopausal or menopausal age now in our country, and during menopause or perimenopausal time, there are studies now says 8 to 10 cases of weight gain is there. So hormonal and many reasons for that. So we won't say it's a normal. Please try hard to fight this normal. We have to be very cautious. We are our ladies are prone to gain this much of weight during that particular period. Please try hard not to gain that weight. We are not saying please start losing weight. Please try hard not to gain weight. So you need more exercise, more stringent control on your diet. And you mentioned you are having disturbed sleep. That disturbed sleep is one of the most important, notorious cause of weight gain. So please have a nice sleep. If there is some treatable cause where we can actually treat, where we can actually find out why she's having disturbed sleep, maybe some family issues, maybe some business issues, maybe some XYZ issues, try to take care of that thing. And if not, maybe some pharmaceutical help is needed. Now we are giving a lot of like melatonin. There's sometimes the wonder drugs. It can helpful without any weight gain. And sometimes we need like benzodiazepines or some associated medications, which also doesn't have any weight gain issues, but we may need help. But better sleep is very important. Take care of your hormonal issues. Do take care of your physical activities. And even then, you are gaining weight, then we really need to look into your metabolic profile, your different reasons. Weight gain is not like it's not like in and out phenomenon, which we you earlier used to think. Obesity is complicated. Obesity is not like what we have eaten is like is going to be there reflected in the weight only. And genetics is to like is has an important role, very important, and then multiple factors are there. It's a altogether different story. But in a patient who has recently gained weight, recently, please look into your feet. Are they swollen? Is this a weight gain because of edema? Is this because of fluid retention? Is this a weight because of some cardiac issues? Because you are 50 plus now. Please look into it and look into your comprehensive metabolic profile. Any liver dysfunction or kidney dysfunction is there. Look into your thyroid profile. That may lead to weight, fluid retention. Look into anemia. Again, it's a big problem. Again, leading to fluid retention and immediate weight gain. Please look into ultrasound. Go for ultrasound because ultrasound is also important at your age, 52 years. Go for a comprehensive gynae checkup. That is also very important because undue gain in weight in a recent past needs attention. That had to be looked into. And first of all, before all this, please look into yourself and ask yourself what you have eaten the last 2 months, honestly, and try to answer that.
Thank you. I think, Alpa Patel ji, you were really lucky. It's really hard to find Dr. Suneet for a consultation, and you've been able to successfully do that. So congratulations for that. And if I'm sure अगर आप ये follow करेंगे जो उन्होंने बताया है, तो definitely you'll feel better. Maybe one more question before we move on to our routine discussion. अफशन जी पूछ रहे हैं कि थायराइड एक लाइफ टाइम प्रॉब्लम क्यों है, एंड अगर मेडिसिन लेके भी हमारा टीएसएच नॉर्मल हो जाए फिर भी डॉक्टर सुनीत जैसे डॉक्टर बोलते हैं दवा खाते रहिए, ऐसा क्यों?
तो उसके लिए समझना जरूरी है कि टीएसएच क्या होता है. टीएसएच थायराइड हार्मोन नहीं है. टीएसएच इज थायराइड स्टिमुलेटिंग हार्मोन, बेसिकली इट्स नॉट थायराइड हार्मोन. टीएसएच हम सिर्फ मेजर करते हैं टू सी क्या हमारा वाकई थायराइड का बैलेंस, थायराइड हार्मोन्स का बैलेंस ठीक चल रहा है. ये एक स्टेबल तरीका है देखने का. हमारा शरीर T3 T4 जो होता है उसको बैलेंस बना के रखता है, विच आर एक्चुअली थायराइड हार्मोन्स. एंड उस जब वो ठीक रहेंगे तो हमारा टीएसएच ठीक रहेगा. तो टीएसएच इज इनडायरेक्ट टेस्ट टू टेल क्या थायराइड हार्मोन्स आर नॉर्मल. फर्स्ट थिंग. सो थायराइड हम क्यों T3 T4 पे, क्योंकि उसका वैल्यूज बहुत वेरी करता है. विच इज लाइक द बेस्ट पैरामीटर इन जनरल टू सी अ थायराइड हेल्थ इज थायराइड स्टिमुलेटिंग हार्मोन, जो हमारे थायराइड ग्लैंड से नहीं निकलता है. सो पहली चीज ये. एंड देन इट्स लाइक हमने एक बार दवाई खा लिया और उसके बाद हमें ठीक क्यों रखना है. हमने टीएसएच को ठीक करने की बात की, हमने T3 T4 हम बोलते इनडायरेक्ट टेस्ट है. तो वो दवाई एंड आपका ग्लैंड मिलके जितना हार्मोन्स बना रहा है, एंड इफ दैट इज कीपिंग योर टीएसएच इन रेंज, इसमें इतना जरूरत आपको था. यदि वो बैलेंस थोड़ा सा पॉजिटिव की तरफ जाना शुरू हुआ कि आप 50 माइक्रोग्राम्स का टैबलेट खा रहे हैं, आपका कुछ टेम्परेरी इश्यूज था थायराइड ग्लैंड में, वो कम थायराइड हार्मोन बना पा रहा था, आपका टीएसएच रेस था, आपने 50 पे आप स्टेबल चल रहे हैं, 2-3 मंथ्स, 3 मंथ्स, 4 मंथ्स, 5 मंथ्स हो गया, आपका स्टेबल आ गया है. नाउ सडनली टीएसएच इज गोइंग बिलो रेंज ऑन दैट सेम डोज. प्रोबेबली योर थायराइड ग्लैंड इज लाइक गेटिंग एक्टिवेटेड अगेन. कुछ सेल्स उसका बेटर थायराइड हार्मोन बना पा रहा है. यू नीड टू रिड्यूस द डोज. सो कीप मॉनिटरिंग टीएसएच, दैट इज इंपॉर्टेंट. आपका ग्लैंड पूरा नहीं बना पा रहा था, इसीलिए हमने थायराइड का दवाई शुरू किया था. इन मेजॉरिटी ऑफ पेशेंट दिस डेफिशिएंसी इज परमानेंट, दैट्स व्हाई द टैबलेट इज परमानेंट. इफ डेफिशिएंसी इज टेम्परेरी, द टैबलेट इज टेम्परेरी. एंड दिस इज मोस्ट कॉमन क्वेश्चन डॉक्टर नितिन सर इन ओपीडीज. आयुर्वेद का दवाई सा साइड इफेक्ट नहीं होता है, दैट्स अ वेरी गुड थिंग. बट एलोपैथी का दवाई एक बार खा लिया तो सारी लाइफ लग जाएगा. So then I usually say, you have taken paracetamol when you were sick in your childhood, why are you not taking it daily? उसका रीजन ये था, दवाई नहीं लगती है, बीमारी लगती है. बीमारी 5 दिन की तो दवाई 5 दिन की है, बीमारी लंबी है तो दवाई लंबी है. हमारी भूख परमानेंट है. हम रोज़ रोटी खाते हैं, दिन में 2 बार 3 बार, चावल खाते हैं दिन में 2-3 बार। बचपन में खिलाया था, दोबारा खाने की ज़रूरत क्या है? वो यूज़ हो गया, उसकी ज़रूरत है ना, उसको शरीर में यूज़ हो गया, तो आपने दवाई खाया तो यूज़ अप हो गया। यूज़ हो गया, आपको उसको क्योंकि आपका जो डेफ़िशिएंसी था वो दैट इज़ परमानेंट या डेफ़िशिएंसी इज़ एट लीस्ट टेम्परेरी या मे बी परमानेंट फॉर सम ड्यूरेशन, सम मंथ्स, सम ईयर, देन यू नीड टू रिप्लेस दैट डोज़। दैट्स व्हाई आपने एक बार दवाई शुरू किया था, तो उस दवाई आपको लेना पड़ेगा। ऐसा नहीं है कि दवाई शुरू किया था इसलिए लेना पड़ेगा, क्योंकि आपका डेफ़िशिएंसी था, हमने इसलिए दवाई शुरू किया था, इसलिए आपको दवाई कंटिन्यू करना है, बिकॉज़ द डेफ़िशिएंसी स्टिल परसिस्ट। अनदर एस्पेक्ट सर, अभी मौका मिला है तो मैं बोलना चाहूँगा रिगार्डिंग यूज़ ऑफ non-iodized salt in our country. This is fad now. काफ़ी टाइम हो गया है एंड वी आर सीइंग प्रॉब्लम्स एंड ऑफ लेट मैंने देखा था मेरे बहुत सारे पेशेंट्स का थायराइड फंक्शन अचानक से खराब होने लगा है। We could find out reason is non-iodized salt, use of non-iodized salt. Somebody has some influencer or some XYZ has influenced people not to use iodized salt. 1980s में हमारे सब टीवीज पे जो ब्लैक एंड व्हाइट चलता था उस पे आता था आयोडीन युक्त नमक खाएं नहीं तो घेंगा हो जाएगा। जो हमारी एज के लोग हैं उन सब ने देखा हुआ है। अभी कोई इसको सबको चेंज करके दोबारा से नॉन आयोडाइज सॉल्ट पे आके वी जस्ट वांट टू हैव अ थायराइड प्रॉब्लम अगेन। सो प्लीज स्टॉप running behind these kind of things. Please start using iodized salt. This may be one important reason why thyroid profile is deteriorating, why they are not getting corrected.
बहुत बढ़िया। सो आई थिंक क्वेश्चंस तो लगातार आते जा रहे हैं एंड आई थिंक डॉक्टर सुनीत यू बीन a super hit for the show, but I will keep going on. एक interesting question मैं लेना चाहूँगा before और question कोई पूछूं। ये सैयद जी कह रहे हैं कि जब हम सब अपनी weight loss journey start करते हैं, it is like a supercharged Ferrari, but a month later we feel like a bicycle with a flat tire. How do we stop this motivation meltdown? And what is the metabolic secret to keep our energy consistent? And I think there is no better person than Dr. Suneet to answer this because he himself, if I may say, is a metabolic freak. He is super fit, keeps himself fit. So let's learn about his secret. $1 billion question for you.
सर कछुए और खरगोश की स्टोरी अलग है। इफ यू स्टार्ट रनिंग लाइक खरगोश ना he will lose. Please set your expectations in a scientific way. Please consider obesity as a chronic disease, chronic illness, not as an acute illness. As I already said, lifestyle modification have to be for life. Lifestyle modification is not for days. So when you are preparing something or when you are molding yourself to go for life, please start slow, be consistent, and be realistic in your expectations. I never say to my patients, you need to lose 10 kgs in 1 month. I say, please try to lose half to 1 kg till your next visit. This is the type of expectations real expectations we really need to put. And if you start, what happens dear, we start like a Ferrari because we expected to lose 20 kgs in 1 month or maybe 10 kgs in 1 month. We may end up losing 3 kgs, 4 kgs, and this will kill your motivation. And if you ask me, 3 to 4 kgs losing 3 to 4 kgs in a 1 month is a huge thing. But still, you are disappointed because your target in your mind was 10 kgs. So please start like a tortoise, go like a tortoise, and keep on working like tortoise. So you won't lose your motivation. That is to be achieved. मेरा मोटिवेशन है, मेरा मूल है, मेरा रीजन है कि मुझे हेल्दी रहना है. Aim is not to lose. Aim is not only to lose weight. Aim is to stay healthy, and exercise, lifestyle, diet is one of the important ways to stay healthy. What if you don't lose weight? What are you losing? Are you losing something? You really need to tell yourself, or anybody who's trying to do exercise for losing weight, मेरा weight कम नहीं हुआ इससे अच्छा तो मैं छोड़ ही देता हूँ. Why? Exercise have different benefits, all type of benefits. You feel fresh. You always like charged throughout the days. if you have done a morning exercise, and our joints are working fine, your muscles are building up, you won't have any fall issues as you grow up. So your blood glucose is getting better controlled, your blood pressure is getting better controlled, your liver is getting better health, your lungs are getting more breaths. So why are you feeling disappointed? Because you have not lost some uh, some ounces, some kgs in your weight. So false, what I feel, sir, is a false expectations from himself or herself is the reason why they feel demotivated at the end of 1 or 2 months. So please be realistic with yourself and just keep on moving. That's the only way.
बहुत बढ़िया. सो बहुत ही क्लियर वर्ड्स में डॉक्टर सुनीत कह रहे हैं, व्हेन वी आर मैनेजिंग मेटाबॉलिक डिसीजेस वी आर नॉट रनिंग अ स्प्रिंट, वी आर रनिंग अ मैराथन. लंबी दौड़ है, आराम से चलिए, जरूर जीतेंगे. राइट, सो लेट्स मूव ऑन टू आवर possibly the last or the second last question. Again asking, we've talked a lot about क्या क्या टेस्ट करने चाहिए, पर इन सब टेस्ट करके क्या फायदा. So let's take the example of glucose. तो क्या अगर हमें पता लगे कि डायबिटीज पहले हो, मतलब मालूम हो जाए टेस्ट करने से, तो उससे कुछ हम प्रिवेंट कर सकते हैं, कॉम्प्लिकेशन प्रिवेंट कर सकते हैं. इज इट रियली हेल्पफुल टू डायग्नोज द डिजीज अर्ली? नहीं तो इसके बारे में क्या कहें?
Definitely, sir. Definite benefits are there. Blood glucose level is a silent killer. If you don't check it, it won't tell you. Duration of that high glucose level has a direct relationship with its complication. I'm telling you, it's not only severity, not only the high values. The duration has a different rate of complication because just because of duration. If you diagnose diabetes today, and if you diagnose the same thing 5 years later, there's a huge difference in complication, be it a microvascular complication or a macrovascular complication. So definitely, sir, diagnosing this kind of chronic illness at early stage is rewarding, always rewarding. If we take interventions, one thing is like last question was regarding motivation. Okay, if we motivate ourselves with this test, my blood glucose level is 106 fasting. My HbA1c is 6.4 now. If we get ourselves motivated, it's not still not diabetes, it's a pre-diabetes. If we get motivated, we get charged. No, I don't want diabetes. I don't want diabetes in myself. Now my blood pressure is also getting to the higher normal range. I don't want high blood pressure. If I start working on it today, I may not develop diabetes down the line, maybe in the next 10 to 15 years. So what I have done, I have prevented a almost inevitable kind of illness in myself by just diagnosing it in time. So timely diagnosis is definitely very, very important. And then if we find something, we can take a timely approach, timely intervention to prevent that further complications of that.
Thank you, Dr. Sunit, for that answer. And I think we are reaching an end of time for the show. Maybe just last one line answer for a question that is coming up. Many times patients say, Doctor, हमको टेस्ट नहीं कराना. We are afraid of tests. We are hesitant to get the test done. तो आप एक लाइन में क्या बोलेंगे, क्या एडवाइस देना चाहेंगे उन लोगों को जिनको डॉक्टर्स ने टेस्ट एडवाइस किया है, पर उनको टेस्ट से डर लगता है, टेस्ट के रिजल्ट से डर लगता है, और वो टेस्ट कराना नहीं चाहते? क्या बोलेंगे?
Counseling is the key, sir. You need to counsel them because that is needed for you. Take your time. Don't get it done today. If you're afraid, don't get it done tomorrow. Think over it. Ask your friends if possible, literate friends. Maybe take some other opinion and get it done. That is needed. अक्सर सर मैं एक एग्जांपल देता हूँ. मैं उनसे बोलता हूँ, साहब मैं और आप जंगल में गए, सामने से शेर आ गया. तो एक बहुत बढ़िया तरीका है, आंख बंद कर लेते हैं और बोलते कहाँ है शेर? शेर तो नहीं है. तो साहब आंख आपने बंद की है, शेर ने नहीं बंद की. तो जो रिजल्ट आना है, तो आप उसमें आंख बंद करेंगे तो कुछ ठीक नहीं होने वाला है. please open your eyes, look into it. Let's try a way to escape from there, to save ourselves from that chair.
Well, Maria, I think it has been absolutely amazing talking to you, Dr. Suneet. Thank you so much for joining us today. And for all our viewers, you have really answered all their questions so patiently, so detailed, so calmly have told everything. And everybody is, praising and saying this is an awesome discussion. Even Dr. Kalrasa has joined and has listened to and said and complimented you for all your answers. So thank you so much. And for all our viewers, we will have KK Med Talks again tomorrow at 7 p.m. with another show. Keep watching KK Med Talks. Namaskar, and we'll see you again later. Thank you. Bye-bye.
Thank you, everyone. Thank you.